Welcome back. Welcome to, if you are new to listening to Rewriting the Narrative. And we're coming in a little spicy today on this Friday. I don't know if you can hear, but the cicadas, the cicadas, I should know what they are, Florida girl, are buzzing away because we've hit like record heat, like 120, like 118 in Tampa, and we just had a little summer shower. So they're out, they're feeling spicy in this humidity, but we're feeling spicy too. Honestly, like Mary, so off camera, Mary, you were just telling me that you had some interactions with consultations this week about just honestly point blank like misguided coaching, and that leading to a lot of fear, a lot of confusion, a lot of overwhelm on your end, on client end. And I actually had a lot of interactions this week with clients communicating with doctors and providers, feeling overwhelmed, feeling misguided, not being given complete instructions, being a little gaslit, being told that, oh, we just put that IUD in, even though you're in pain and want it out, we just put it in. Right? Like, and then on your end too, just being, told like, oh, well, this is the way it is, or I said so. And we're not really about that. So before I get too into it, so like, you guys know, like we talk about like functional health coaching. And I don't know, Mare, to me, when I talk about like functional health coaching, like that doesn't mean a pill for every ill. That means the opposite. That means we step back and look at the person as a whole. So not just their body and how all the systems of their body are working together, but them as a human being, including their history and where they're at right now, their mental health, their spiritual health, emotional health, all of the things. And that is functional health coaching. It's not, oh, your liver enzymes are this, so here's some TUDCA. Your anxiety is this, so here's this circadian rhythm protocol. No, it's stepping back and looking at the whole person. And I'm going to say a lot of coaches in our space have lost that and are trying to be that, but they've lost that and say that they're better than doctors when they're doing the same shit that a maybe doctor who is a little bit misguided is doing, in that they are just literally giving someone a antidepressant for this and a NSAID for that. Yeah. And not asking about their diet, not asking about, their relationship, et cetera, et cetera. So that was like a 3-minute intro. So I apologize, you guys, but it's been on my brain and my heart. And this is our space to have a therapy session sometimes. So Mare, you so like graciously just let me babble.
No, I think the babbling was very aligned. To piggyback off of what Sarah said, number one, we do not believe that anybody is intentionally ill-willed.
No. And I said that in an email this week. I would just like to confirm that.
Yeah, when it comes down to physicians, I do not know of one physician or, licensed medical provider that would go willingly and spend 8+ years of their life giving up a lot of social events to be studying and passing board exams to just flake out. But fact of the matter is, and this actually is something I will mention, is the time that it takes to research, the time that it takes to stay on top of things that we continue to learn, it takes time and it takes a lot of effort. And these are the things that arguably perhaps a lot of individuals, whether they're physicians or coaches, don't take the time to do, or they partially do it, meaning they read the headline, but they don't actually continue to read like the actual information of who this was applied for. I'll give a small example just so I'm staying on topic here. For the example of, I'll give the example of TUDCA because you mentioned, high liver enzymes TUDCA, and that's a great one. So when we're thinking about giving a supplementation, for TUDCA, for example, I was on a consultation this week where the female was told this would be helpful for estrogen dominance. I was really thinking about that and I mentioned this on a reel, like if I squint hard enough, then I can come up with a rationale that would sort of possibly make sense if we're getting into the nuance of detoxification, bile support. But in the grand scheme of this human being, and I even tried to get on the same idea of, well, this person, we do have blood sugar regulation issues. And so could that be something that we're concerned with here? But when it came down to it, it was just such a roundabout way, and it wasn't the right way for her. It just didn't make sense. Quite a lot of that. And this is where, like to what you mentioned, going into the doctor's office and them simply saying, oh, you have high cholesterol. You need to be put on a statin. There's absolutely a triaged protocol for providers when it comes down to intervention. Does this person have this risk factor? Do they have that? To which the next step in this tree of triaging is put them on a statin. But what we hope for is that you're with somebody that's like, okay, now wait a second. Like, is this person eating well? What is this person doing? And is this recommendation, just because a statin could be good for cholesterol, is that really good for this person in this case? I think that honestly, what stemmed this podcast was a conversation that you and I had about not educating our clients and giving them the full understanding to make decisions, and just telling them, this is where you're at, this is what you need to take for it. And I think it actually came off of something that we saw with regards to supporting hormones, and we've talked about this numerous times with it comes down to, Vitex or Progon B or any of these things to be supporting LH and progesterone, and arguably, even some estrogen if you're talking about Vitex. We have to come in context about, like, you have to educate the person. Just because a female has low levels of progesterone, this is where that triage, going back to the statin, is you have a female, that's step 1 on the tree. She has low levels of progesterone, step 2 on the tree. So is really step 3 to give her Vitex? Well, no. You have so many more branches and leaves that you need to look at. Like, to your point, what you said, like, is this a female that has low energy availability? Do we need to work on feeding her more? Is she a female who's of reproductive age, to which this may be beneficial? But then also to a point that Sarah made on a previous podcast, I think we were talking about lower energy availability, which there'll be a lot more podcasts on that, is well, how long has she been there? So maybe for this client, depending on how long she's been in this state, she's now committed to doing the day-to-day lifestyle things that she needs as far as feeding herself more, improving recovery. So maybe for her, she does need Vitex, or maybe she's in a point where she actually needs actual micronized progesterone for a time period. But you say that, take that same scenario, step 1, a female, step 2, low progesterone, and you put her into a perimenopause woman, respectfully, she can eat from the damn chaseberry tree, and she is not going to start producing more progesterone. Like, but
Right.
This is what people aren't thinking.
It's supplements versus expectations, and knowing the power and the purpose of that supplement, whether it's, whatever it is. We could be talking about magnesium, or we could be talking about 5-HTP. We could be talking about, even medications here. Like, again, like you said, like, why are we like being put on the statin? Like, what is the expectation here of what this intervention is going to do? And then what's the long-term play? Because the word supplement, let's even break that down. Supplement is supposed to support, right? It's not supposed to be a crutch. And that's what we have to be really careful with. Now, Mary and I love supplements. Like, don't get me like there's
don't look at our cabinets.
Yeah,
I've seen Sarah. So
like I have like don't like it's good. Like we're on the supplements. Like we like it. Like magnesium, like fish oil, like I consider those to be like foods, essentially. But like I understand what they can and cannot do. And I understand the ones that I have in long term, why I have them in long term. And I think like I see that a lot. Like onboard a new client, I'm like, well, why are you on this kidney support? And it's like, oh, well, I was told that my kidney function was low in my labs 3 years ago. And it's like, okay, well, when was the last time we had lab work done?
Yeah.
Most recently I had somebody taking iron, zinc, B vitamins based off some labs 6 months ago where there was mild indication of nutrient deficiencies. But this person was on all these supplements with no instructions on follow-up testing. And again, like nutrients interact with each other. So go back to that iron, episode. But anyway, again, like the idea here is that those supplements are supplementing and they aren't a crutch. They aren't an end all be all. And, leaving someone on one like without any instruction or without a why is a major disservice. So we're really big on like people will ask me that, like, oh, when you coach, do you educate? And I'm like, how do I not? Like, it's hard for like, how would I not? Like, I don't know. So for example, you guys listening, because you don't even, maybe you haven't worked with me, when I'm recommending like, hey, like I'm gonna add this, selenium to your plan based off this recent set of lab work. We're looking at your thyroid, we're looking to support thyroid function. Selenium, super awesome ingredient. Let's follow up in a couple months, see where that full panel is. It's going to benefit immune system, it's going to benefit that thyroid gland. It potentially could be one that we leave in long term here, but let's also see where your levels are at, because maybe we go to an every other day approach. Like maybe we look at what other, support might be needed, because you might need something stronger than selenium. As far as supporting that thyroid, we might need to step back and look at your gut health as a whole to better support that thyroid conversion. And I'm explaining this when I'm just recommending selenium. Like I'm not like, I don't know. And Mare is the same. So I know she doesn't need to confirm, but yeah, I think we just need to know like what the long-term play here is, and also like understand with where you're at. Like let's use like another like perimenopause example. Like if you are someone and you're thinking like, oh, vitamin D to support my bone health in perimenopause, like hell yeah, girl. Like you've heard about osteoporosis, osteopenia, but all the vitamin D in the world isn't going to deny the fact that hormones are downregulating and eventually going to go, low to non-existent.
Yeah, exactly. No, I couldn't agree with you more. Like I think that the other thing too for coaches, who are listening to this podcast, one, education is huge. Sarah and I, we ensure that clients understand our thinking, and something I want you just to recognize that she said that again I champion is we educate clients on our rationale and our thought process, what's going on in our brain, but it's not a dictatorship.
Oh, and I'm also usually, especially on a call, this is my best, I'm not going to say guess because it's not a guess, but this is my best recommendation. This is what I would do if I were you. This is what I would do if you were my mother, based off what I know. And I also think we should follow up with XYZ person, too.
Yeah.
And don't be ever afraid to recommend that as a coach. That's super important.
Yeah. I think too, like, making sure that for us, the client must be the one who makes the choice to add whatever medication, to add any supplementation. It is up to the client. And I think that that's a twofold thing. So, one, by us providing education and because again, we are going to be kind of like that authority as far as like knowledge base for the client. That's why they've hired us. We have, one, the book knowledge, we have the real world application, we have definitely the anecdotal knowledge. But they're looking for that from us. But then as our clients hire us, our role as coaches is to give them the confidence to make choices about their life and their body. It is, if a client just says, I will do this because you say it, I literally stop and say,
No, 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 no.
I tell them, I said, if that's the reason you're doing it, don't do it. Do not do it, because you must have autonomy on your body and what you are agreeing to do. And I think that that's the thing, the difference, probably in arguably like how Sarah and I, like whenever we came into like any type of medical appointments, I know myself as like a young woman, it was always like, well, whatever they said, I had to do, right? Whatever they think is best. You don't ask questions. If you ask questions, you're being difficult. But we're like, no, we don't want you to come from a place of scarcity. We don't want you to meet providers with anger or frustration, but ask a question, and you deserve to have answers. And if those don't resonate with you and you don't believe in them, it's going to be a moot point.
Yeah.
The mind is fucking powerful. And if you do not believe in the actions that you are doing in your day to day, if they do not align with your morals and your ethics, and arguably maybe those need to evolve too, it is going to fail you.
And this goes beyond supplements. Like this goes to every like, I brought up like a circadian rhythm protocol.
Yeah.
Like, is it really realistic for you to go out on your, 10-minute walk to get that low angle sunlight, or whatever we're calling it now? I'm all for that, like these things and these tools and biohacks, as people call them, but like things really do line up in the research. But like let's also like understand what the research is really telling us. Like kiwis were having a moment on social media like a month ago, because like there was a review article like going over different nutrients and supplements for sleep, and kiwis came up as far as some research. It was a review article, so it was looking at other interventions out of other research trials. And anyway, the headlines on social media were, kiwis help sleep, kiwis increase or decrease time to fall asleep and improve deep rest, blah blah blah. So I, of course, because one of my clients shared it, so I, of course, went and read it. And what the studies actually show is that kiwi, concentrated dried kiwi, like supplementation, maybe helped as far as subjective sleep quality, but there was no actual like testing done, and you had to eat the skin. Like the studies like were not like, honestly, like I've forgotten like all the specifics, but it was like very marginal, if any, benefits, and most of the benefits came down to subjective improvements, not like objective like data. And my friends, placebo is a powerful drug. So I am all for the kiwis.
Yeah.
But let's also like understand that like, hey, if your client is struggling with their sleep because maybe they have no estrogen and their like marriage is tumultuous, the 2 kiwis are only going to go so far. Like if we don't talk about like those other things, like, so that is, I think what we're also like just trying to get at here is like, what is the elephant in the room? And again, going back to supplements and kiwis, absolutely, those things can support while we do what I call the work, which honey buns, the work is often stuff the coach can't even do. And, that's like, you guys showing up, putting in, the hours in the gym, or, challenging yourself to increase your food, or put boundaries in place in your life, or suck it up, buttercup, and go for that morning walk, even though it's cold or it's hot as balls, and like It's like these little things that are really the big things, like chewing your food. And the magic digestive enzyme is not going to fix your terrible, grazing habit, or the fact that, we never sit down for, a meal, right? Or, again, like it's like these details that like matter, but they don't, right? Like the analogy I like to give is a cake. Like if you're spending all this time like researching like the perfect frosting recipe and getting the best buttercream, but your cake is flaky and dry, well, that gorgeous icing is going to look like shit on the cake, first of all, and the whole thing is going to taste bad because your cake recipe sucks. So we got to work on the cake before we stress about the icing.
Oh, I like it.
And getting down into the weeds about like this strain of probiotic versus that strain, you're missing the forest for the trees when your girl just needs to eat more fiber and chew their food and make sure that they're actually absorbing the nutrients that they have, or like they don't even need, that strain of probiotic in the first place. But stay tuned because I have an entire blog on probiotics coming out here shortly.
Yeah, I cannot agree more. I think for coaches who listen to this, my biggest suggestion would be to slow down. Something I've said now numerous times on consultations, and even we've said on social media, and we will continue to say it, is when we are coaches and clients are coming to us, especially dealing with symptomatology, we cannot become a sponge, right? So we have to be, what's the phrase? I loved your cake thing, so I have to come up with a really clever one, but I'm not going to come up with this one, but it's one just to remember. Being a thermostat over a thermometer. So we cannot match a client's reactivity. And this was something I've talked to several people about this week, is we have to be patient. And I painted almost the picture, and they didn't even realize it, of all the things that they're currently and already doing to be making steps in the direction that they want. But arguably, I'm like, I think that you just need it mapped out for you on, hey, do this, wait 2 or 3 days. Do this, wait 2 or 3 days. And I said, I know that hearing the word wait and patience for many people is synonymous with sitting around twiddling your thumbs, and I was like, but it's not. Arguably that's where the magic happens.
No, I mean, for me, like, because I'm that person too. Like, I want to get shit done. Like, let's get the show on the road. For me, understanding adaptations, like that framework was super helpful. So I don't know about like for you, but like understanding that yes, X plus Y equals Z, but not that fast, right? Like, let's use like training, right? Like, you would not expect once you're past like bare newbie stages, like you're not going to get stronger every single session. Like, you might be at the same load and rep, for that, set of your squat for 2-3 weeks, and that is totally okay. And then all of a sudden you'll have a good big jump, and like, or all of a sudden that same load and rep feels like way easier. Muscle growth, like it doesn't just happen tomorrow that you actually like build muscle. The body needs time to adapt. Same thing on the health side of things. Like, yes, we started, sleeping more. Like, we added in these supplements, we changed these things with your diet. Well, how long was the body adapted to doing something else and, making you feel like shit? It's going to take a little bit of time for us to see, these interventions produce, another, a change in the other direction. And this is where like, I think a coach can be really helpful because yeah, like maybe like, let's say metabolism and thyroid, like maybe, we aren't seeing the changes lab work wise. Maybe you're still having, cold hands and feet. Like maybe our sleep isn't great, but maybe you notice like subtle things, your brain is a little bit sharper in the morning, or, you're having regular hunger signals. Like just these subtle ways that the body is showing it's adapting, I think can be really helpful to hone in on. But again, like understanding that the body is incredibly beautiful and complex, and all the parts work together. And it's not just you address this one thing and everything else falls in place. It's all these channels are always influencing one another.
Yeah.
And this is for that same reason that we can't just expect that you add in this one magic supplement and the whole system starts kumbaya again.
Yeah.
Right? Like it's not, it doesn't work that way. And if you have this kitchen sink approach where you have selenium for thyroid, you have Vitex for progesterone, you have a probiotic and an enzyme for gut health, and you have no idea why, or you still feel bad, you're missing the reason why we have this flood of symptoms in the first place. And we need to step back and ask, like, what are we really doing here and what's really going on? And it's the same issue in, you know, where coaches, like I said in the beginning, bash the medical system, you know, where people are on, you know, a pill for every ill. Well, the pills, you know, in your supplement cabinet count in that.
Yeah, it's so true. I'm going to piggyback off of what you said. I think too, this is where having a coach that has a really broad lens and has looked at every tree of said forest and now is looking at the entire forest and working with a provider that also has a very similar lens. I think this is where that really beautiful relationship can happen, because ultimately with a provider, they are going to come in and it is going to be very direct and to the point. They have about, if you're lucky, 30 minutes. That's probably people that just heard me say that and be like, I don't know what provider you're going to. I get like 5. But if you're going to like a private clinic, you have like 30 minutes and they're looking at very specific things. But this is too where you, as a knowledgeable client who has had a coach that has educated you, for example, with the cholesterol thing, bergamot is a supplement that's often recommended if we're really concerned about lipids and we're you know, done all the other things as far as thyroid and gut health and all the things that can, you know, affect your cholesterol. So say your coach, it was suggested that you do citrus bergamot. This is an opportunity that you as a client and perhaps your coach in tote can say to the provider, hey, we are doing all of these things. We have, you know, the sleep, you know, all the basic foundation stuff, and we've actually added in specific interventions from a holistic standpoint to try to move the needle. And guess what? The needle is not being moved. So now the conversation gets to be advanced. You get to take advantage of all the other levels in the functional medicine space of, are we now to that point where we get to do additional, more nuanced testing? Do we need to do the more additional nuanced testing? Do we need to do a more advanced interventions, right? You know,
right,
peptides, etc.
Right.
But if you don't have that knowledge base and you don't know what the fuck you're taking and why you're taking it and what the outcome is supposed to be in a timeline that we should hypothetically see some changes.
Right. And, or like understanding the importance of being responsible and having follow-up appointments. Like, let's see if that citrus bergamot quote worked, because then we can come off of it. Like we don't have to keep spending, I don't know how much it is, like $30 a month and maybe having like orangey burps because it can have that effect. Anyway, like, you know, like it's all like there's got to be a method to the madness. And I had a client send me that the other day. She's like, I did what you told me to do, which again, I'm like, I'm glad you did what, you know, I'm glad that you gave this a shot. But she's like, I understand the method to the madness. I'm like, there is a method to the madness. Like, I know I'm annoying for telling you to chew your food, but there is a method to the madness because these things, they work when you work them. And that, you know, too, like, again, like it gives us a bigger lens to see what you need, you know, holistically here.
Yep, exactly. So take a step back, guys. Look at what you're taking, why you're taking it. We're not suggesting you don't need supplementation. Arguably, we can definitely argue the point that you do, and you may for a long time, and you may need things for a very long time.
Yeah.
But just continuing to take more and more and more and more, risky business.
Yep. And if you don't want risky business, if you want, I feel like that was kind of dirty.
That was great. I really liked that. Like that, I was like smooth.
If you don't want risky business and you want to work with some coaches that have a strategy and a good sense of humor, We do offer strategy calls where we like deep dive into your history, into your labs, recommend follow-ups, look at what you are doing, what you're feeling, who you are. Like we'll have a nice chit chat and create a plan for moving forward. You can learn more about those services on our website. I'll have that in the notes. And if you are a coach or you're like, yeah, I want to better understand why I've been told to give my client X if they present Y, and you want to have a better Z for all parties, we offer mentorship as well.
Yeah, I'm gonna just toot our horns. Like the group that we have they're awesome. Like we have incredible conversations. Incredible. Hype us up, that's for sure.
Amen. The group chat was popping off with everyone chewing their food.
Yeah, true.
Okay. We will see you guys next time.